Good morning, one and all present here. Myself, Gayathri R, postgraduate, Saveetha College of Physiotherapy. My co-author is Dr. Ramana K, Associate Professor, Saveetha College of Physiotherapy. My title is about effectiveness of MFR versus mobilization on pain, maximal mouth opening, and quality of life in temporomandibular joint. Introduction. Temporomandibular joint disorder is a common condition characterized by limited jaw mobility and pain with difficulty in doing mouth activities. Myofascial release and joint mobilization are two manual therapies used to improve TMJ joint function. Temporomandibular joint affects up to 30% of general population. The maximal mouth opening is a critical measure of TMJ function, with reduced maximal mouth opening being a major symptom of TMJ disorder. Myofascial release and mobilization are two manual therapies commonly used to improve TMJ function, maximal mouth opening, quality of life of the people who suffer from TMJ disorder. However, the comparative effectiveness of these treatments remain unclear. This randomized control trial aims to compare the effect of MFR and mobilization on MMO and quality of life in patients with TMJ disorder and produce a valuable insights for clinicians and researchers seeking to optimize treatment outcome for the prevalent condition and improve their functional activities of the daily life from the patient who suffer from TMJ disorder. The review of literature are from Odokar and Patil 2022 concluded that myofascial release and joint mobilization are effective conservative treatments for TMJ dysfunction, improving pain, mouth opening, and overall functional outcomes in patients. And Gil Martinez et al. At 2018 emphasized that manual therapy, including myofascial release, effectively reduces pain and improves function in TMJ disorder, supporting its use as a primary conservative intervention. And Azim Shah et al. 2015 reported that myofascial release significantly reduces chronic and musculoskeletal pain and improves function, supporting its effectiveness and intervention for conditions like temporomandibular joint disorder. And the background of the study is temporomandibular disorder is a common condition characterized limited jaw mobility and pain with difficulty in doing mouth activities. Myofascial release and joint mobilization are two manual therapies used to improve TMJ function. Temporomandibular joint affects up to 30% of the general population. Maximum mouth opening is a critical measure of TMJ function, with reduced maximal mouth opening being a major symptom of TMJ disorder. Myofascial release and mobilization are two manual therapies commonly used to improve TMJ function, maximal mouth opening, quality of life of the people who suffer from TMJ disorder. However, the comparative effectiveness of these treatments remains unclear. The randomized trial aimed to compare the effects of MFR and mobilization on maximal mouth opening and quality of life in patients with TMJ disorder provide valuable insights. And research gap. Even though treatment like myofascial release and joint mobilization have shown good results for people with temporomandibular joint disorder, there are still some important gaps in the research. Many studies have looked at these therapies separately, but very few have directly compared how effective they are against each other or when used together. Also, the number of participants in these studies is often small, and the treatment method can vary a lot, making it hard to apply the finding to everyone. Another issue is that most research only look at the short-term result, so we don't know how well these treatments work over time. Tools that measure how TMJ problems affect daily life like jaw function or quality of life and also not used enough. Because of these limitations, there is a need for larger, well-planned, consistent method and focus on both short and long-term outcomes. And the need for the study. Temporomandibular joint disorder are a common cause of orofacial pain, functional limitation, often affecting daily activities such as chewing, speaking, and yawning. However, there is a lack of clarity regarding which technique provides better outcomes or if combining both methods lead to enhanced results. Existing studies often focus on short-term effects, involve small-size samples, or do not use standardized outcome measure, making it difficult to draw strong clinical conclusions. Aims and objectives. To compare the effectiveness of the myofascial release and mobilization on maximal mouth opening and quality of life in patients with TMJ disorder. Objectives. To evaluate and compare the effectiveness of myofascial release and joint mobilization technique to improve maximum mouth opening in patients with TMJ joint disorder. To assess and compare the impact of myofascial release and joint mobilization of quality of life in individuals diagnosed with temporomandibular joint disorder. Methodology, study design, experimental study. The study setup is Saveetha Medical College and Hospital. Study duration is 4 weeks. Sample size 108. MFR 54. Mobilization 54. MFR versus mobilization is given for 30 to 40 minutes, 4 sessions a week. And my inclusion criteria is adult age 18 to 65 years, pain and tenderness on TMJ, limited maximal mouth opening is less than 40 mm. Exclusion criteria is previous TMJ surgeries, TMJ fractures, any dental condition, neurological or musculoskeletal condition. My outcome measures are from NPRS scale and quality of life scale, jaw functional limitation scale. And my outcome measures are to assess temporomandibular joint disorder. Several validated tools are commonly used. One of them are jaw functional limitation scale, evaluates limitation in jaw movement during activities like chewing, speaking, or yawning. The numerical pain scale allows patient to rate the pain intensity from 0 no pain to 10 worst pain, offer a quick and reliable pain measure. Maximum mouth opening is measured in millimeters to assess jaw mobility and function. Quality of life scale such as oral health impact profile help to determine from the TMJ disorder affects a patient's physical, psychological, and social well-being. And these are the scales attached with the presentation, and these are the images of the patient while doing the research work. And result, both groups showed significant improvement in maximal mouth opening, quality of life, and pain intensity. However, Group A MFR shows greater improvements in MMO and jaw function compared to Group B mobilization. Result of this study have implication of the treatment of TMJ disorder and highlight the importance of considering both MFR and mobilization as treatment options. Further research is needed to fully understand the effects of this treatment and to determine the most effective treatment protocols. Additionally, studies of examining the combined effects of myofascial release and mobilization provide further insights to most effective treatment approach to the TMJ disorder. And this is my graph showing pre and post-test scores of the MFR and joint mobilization group. In discussion, the goal of the study was to evaluate the effect of MFR and mobilization on MMO in patients with temporomandibular joint disorder. Azimsha et al. 2015 conducted a study on MFR on musculoskeletal condition by reducing pain and improving functions of the TMJ joint. And Brown D. Castro et al. 2017 conducted a systemic review to evaluate the effects of manual therapy on temporomandibular dysfunction, focusing on myofascial release and joint mobilization technique. Joint mobilization technique results in improvement in MMO but lacks sustained effects on pain relief. The authors concluded that the choice of treatment should be tailored to the patient's primary symptom, with myofascial release recommended for pain management and joint mobilization for improving mouth opening to determine the most effective treatment protocols. Conclusion: the myofascial release for TMJ was effective according to the findings, are more effective than the TMJ mobilization, as the myofascial release for TMJ showed a higher positive outcome than the TMJ mobilization in reducing the maximal mouth opening, quality of life, and pain in TMJ joint. And these are my references of my research work. Thank you.